It's all of our responsibility to help support our students during our clinical placements.
It's about enriching that experience and creating an action plan to give them the things that they need, the tools that they need to be able to pass and grow and develop.
As a teaching hospital, I'm always delighted to see the many students who are here with us on placement, preparing for their future careers and already contributing to the care that we provide. Central to the success of these students is our practice education team, who provide support to them as they carry out their clinical placements within the trust. Working closely with our further and higher education partners, they facilitate quality placements and help students develop highly attuned skills. Today we will hear from Sarah Scholes, Education Lead, and Rachael Mathers, Practice Educator, who tell us more about this important work.
As a practice education team, me and the team are responsible for welcoming students that are going to be registered with the Nursing and Midwifery Council and the allied health professionals as well. So basically that's all students unless they're training to be a doctor. Our team is made up from an administrator, Hamid, who is amazing, answers the phone, answers student queries. We have a physiotherapist, we have a radiographer, and we have 2 midwives, and we also have a nursing associate.
We support our students when they first come on placement at the trust with a trust induction.
We talk about communication, we talk about uniform policy, confidentiality, all the key things that are really important.
And we offer sessions alongside, such as our twice monthly multi-professional learner forum, and then sessions such as foundations of patient care skills.
Today we're here to go over some training regarding personal care with patients and just building up our skills. I feel like the mentors and the practice educators have like a big role in building your confidence with things that you don't necessarily get taught at uni. You have a bit more time to work out, am I doing this right?
Because all of our students are really diverse, they've all come from different backgrounds, of different experiences, the level of support that we offer can vary from student to student, whether that's student drop-ins for some peer support or coming to sit with a practice educator one-on-one to work through some things. So how are you doing? How is placement going and how is second year?
They need to have hands-on practice, which is why they come out into an acute trust where they are able to learn how to carry out the tasks that they've been taught about in university. They're going to come across situations that they've maybe never faced.
We offer the students a lot of pastoral support and see how they're getting on placement, and then try and identify if there's any students that do need any additional support.
It's about enriching that experience and creating an action plan, not for the student to be failing at what they're doing, but to give them the things that they need, the tools that they need to be able to pass and grow and develop in their placement. I really enjoy teaching students. I really enjoy being in the big lecture theatre and talking to students, and I teach from a place of what happens in the real world.
I feel like with the placements I've been on, it's really developed me as a person and as a physiotherapist as well. So I really feel it'll help get me set to where I want to be.
When you're supporting a student out on placement, it's really important to remember that we've all been there to show that care and compassion to our students. It's all of our responsibility to help support our students during our clinical placements, and they do bring such a great deal to the clinical environments and to patients.
To make a difference to someone who's going through a massive learning journey and mould them into the practitioners for the future, that's something that I am really passionate about, and it's nice to see them thrive.